So welcome everyone. My name is Peter Bell. I'm the planning and strategy. I'm the chief planning and strategy officer at Sacramento Steps Forward. I'm thrilled to be with you all today. I myself was a CAS assessor for many years, working with young people who are experiencing homelessness, trying to navigate the system, the complex systems of care. As many of you are out there today, helping your clients navigate through various different systems, including the coordinated access system. So our goal today is to really welcome in the new cohort of CAS assessors. And so as we kind of mentioned in the Q&A, but we'll also talk through the chat, this training really is designed for folks who do not currently have access to complete CAS assessments. Um, I know there are folks who do have access and want the refresher, as well as just ongoing opportunities to continue to enhance your learning. And so that's great. We're not turning anybody away. That's why we have the large Zoom room. It accommodates over 500 participants. So we always want folks to be able to have an opportunity to join in, ask questions, be a part of that group. But just know that for those of you who currently do assessments, this may be a bit of a refresher as we go through the various different training series we have. The other thing I'll say is that this is a bit of a new approach for us as we've kind of redesigned the training. In the past, the training to become a CAS assessor was fairly limited. It was focused pretty much exclusively on HMIS access and being able to kind of walk through the assessment within HMIS, be able to pass the quiz and do those things. So we've made some changes over the last few months. We recently completed a recertification process with our CAS assessors. And so we've learned some lessons from that. And now we're kind of moving on to developing some processes for folks who are newly entering to the system. So you're kind of our first cohort that's going through this approach. So we'd love to hear your reactions and thoughts to this as we go along. This is part one of a 5-part training series. So if you've attended today and you're interested in being a CAS assessor, you will need to attend the other 4 sessions as well. But hopefully they will all be valuable learning experiences for you and do help further enhance your learning and your effectiveness as a CAS assessor in the field. So what we've done is we've essentially designed this training series to be kind of the ideal starting point for anyone who's doing this work in terms of learning about key important concepts like trauma-informed care, implicit bias, vicarious trauma, conversational case management. These are all really foundational concepts in many ways, as well as providing you the tools and walking you through how to use them effectively as a CAS assessor. So that's kind of the overview. So we are, again, offering a 1 training course per week for the next 5 weeks. So we do hope that you'll join us for all of those. Now, let me go ahead and get my presentation up once I find it. All right, let me share my screen. Let's check the chat real quick too. All right. Should we be doing an HCT with all individuals that are interested in getting on the housing queue? If not, what criteria we should be looking for? Okay. And if we are already have access, is this training requirement for us or we try to take it again? Ah, great. Love that. If you already have access, no, this is not a required training. You've already become a CAS assessor. So if you are currently a CAS assessor, you do not have to be here. It's not required. We will have a recertification process sometime later this year for folks who are currently CAS assessors. But this is really, again, designed for folks who are just coming in and have not yet done that. So you're more than welcome to stay. You're welcome to attend the other sessions as well to get refreshers. But if you're already a CAS assessor, you do not need to attend these trainings. This is, again, designed for folks who do not yet have access. All right. Kim inherited CAS at her job and doesn't know anything about it or what to do with it. You are in the right place. Yeah, you're absolutely in the right place. So hopefully you have HMIS access and you have an opportunity to learn more about what it is to be a CAS assessor. Also note folks probably can't see the chat. It's just me. Um, so one other question. Oh yeah, back to the should we be doing the HCT? Yeah, the housing conversation tool. We'll talk more about that in next week's training. We'll actually kind of walk through that process and then how to create an individualized service plan. But absolutely, the housing conversation tools hopefully a really good tool for you and just developing case management plans, as well as kind of understanding the pathway that someone might need to take to exit homelessness. How often will this course? Yeah, if you don't have HMIS access, that's sorry. If you have HMIS access but not CAS access, you're in the right spot. So this training series is designed to give folks who have HMIS access but are not yet a CAS assessor access to those tools that CAS assessors use. You also have to pass a quiz and sign a user agreement form, which we'll talk through a bit today as well. Janet's excited to get better understanding of CAS and its application to best support clients. Yeah, 100%. Could this course be educational? Yes, we sure hope so. All right. And let's see, I have access and then no access was longer there. Yeah, so if you previously had access, I'm going to answer that one live, and no longer do, it's probably because you did not complete the CAS Assessor recertification last year. So you will need to go through these trainings to become a CAS assessor now. So if you do not yet have HMIS access, again, you're more than welcome to continue to be here. We definitely recommend that you go ahead and start that process as soon as possible. You will not be able to complete your CAS assessor certification unless you also have HMIS access. So the Homeless Management Information System, um, that is the acronym there for HMIS, and you'll need to make sure you complete that user process. If one does not have access to either systems, will this allow us to both? Not sure what that means. Either systems. Okay. How often will this course be available? That's a great question as well. So we're still working through how often we want it to be available, for sure quarterly. So we'll offer the CAS assessor training on a quarterly basis at minimum. We've talked about potentially more frequently. All right. Today's trainings will be available to watch later. And how do we gain access to become HMIS certified? All right, I'll have someone on our team drop a link to that. All right, welcome, Mike. Okay, without further ado, a lot of questions. I love questions. All right, if you can give me share access, Jody, then I can go ahead and share my screen.
Done. It's all yours.
Thank you. All right. Here we go. We'll get back to your questions. No worries. We'll have a break. I can also answer more of your questions on the go, and we'll have lots of opportunities to answer questions at the end. So welcome, as I said, to the CAS 101, Coordinated Access System 101 review. This is again designed for new CAS assessors, but hopefully you'll take something along the way. So what are we going to focus on? So the goal of today is to help you understand the role of the Coordinated Access System and all of our many acronyms. You'll learn that we love our acronyms here. The role of CAS in the homeless response system, to learn the Coordinated Access System Assessor Responsibilities, or CAS Assessor. You've heard me say that a few times already. So what are your roles and responsibilities as a CAS assessor? And you'll also learn how to navigate CAS processes, tools, and resources for support. So if you're never heard of the Coordinated Access System before, you'll learn a little bit more about what that is. You'll learn what kind of resources are available within the system. And you'll start to learn a little bit more about how a CAS assessor navigates clients through those various resources. You'll learn a little bit more about what an access point is, and you'll start to get an introduction to some of the work that we're doing here. So let's start with understanding the coordinated access system. So essentially the coordinated access system, or the CAS, is, if you've heard of coordinated entry, there's basically, equivalent. It's the same thing. So if you heard coordinated entry in the past, you're hearing coordinated access, just know that those are the same things. Really, the goal to change the name is also to move us more into kind of a person-centered model and to help sort of model that. So the coordinated access system is a network that's designed to match people who are experiencing homelessness or at risk of homelessness with shelter, housing, and service options. The CAS helps connect people with the highest needs to housing and support services as quickly as possible. So essentially, there's kind of four critical elements of any coordinated access system, whether it's here or in Marin or San Diego, right? They all essentially have the same four elements, which is access, assessment, prioritization, and placement or referral. And let me just minimize that. Okay. So access is really about where do folks who are seeking services, what are those points of entry, right? So we often will refer to those as access points. What happens at those access points is that you'll have staff who are CAS assessors, right? Who can assist in triaging a client to understand what their immediate needs might be, supporting them with a crisis response approach, connecting them to resources when possible, including those that may be outside of the system. And they do that through the assessment process, right? So the assessment process, you'll learn more about today, but essentially in our community, we utilize two different types of assessments primarily, which is a crisis assessment and a housing assessment. And so locally, we refer to the crisis assessment as the crisis assessment. So it's easy to find. And the housing assessment is the housing conversation tool, which is a locally designed tool, which we'll talk more about as well. Through that assessment process, we also want CAS assessors to be utilizing conversational case management, which we refer to as housing problem solving here locally. And that's essentially being able to go deeper with the client to understand what their needs might be, what vulnerabilities they have, and helping to, understand a bit beyond, at a face level, at a surface level, like what's going on in that client's life and experiences. So one of our trainings that we'll have later in the next couple weeks is actually an introduction to conversational case management, and you'll learn a little bit more about how to do that approach. And one of the things that we also require all of our CAS assessors to do is actually complete a conversational case management training within 90 days of becoming a CAS assessor. So we offer housing problem solving as an option for that. And you're also welcome to do something like motivational interviewing, which is another popular conversational case management approach. So that in many ways is the heart of the engagement, is that as CAS assessors, you have the assessment, but you're also being able to kind of have those conversations with folks and understand, are there opportunities and connections that they can foster outside of the system as well, whether it's through family, friends, and relatives, or other programs that they've leveraged in the past that they find to be successful, and sort of seeking to re-engage them through those processes. And of course, what we do when we do have resources available to folks is that we actually do have to do a prioritization process. And it's nobody's favorite thing, but it's because, we're still operating under the reality that there aren't enough resources for everybody who needs them. We'll talk more about that later too. But essentially, what that means is that we have to prioritize the limited resources that are available through the system to those with the highest vulnerability factors and some of the greatest housing barriers, to make sure that the limited resources go to those who will most likely, are the most vulnerable to death, dying, by remaining on the streets, and those who may have the most difficult time finding like market rate housing independently. And we'll talk more about how we do some of that and how we front load some of that prioritization so that you don't have to become an expert around all of that work, but how do you work with folks that we kind of have deemed extremely vulnerable? We'll talk more about that extremely vulnerable households policy later today and how that works in practice. And ultimately, just know that here at SSF, we manage the referral system, and we work in partnership with our colleagues at 211, Community Link Sacramento as well, to help manage referrals into both shelter programs, crisis resources, and housing. And so you'll learn more about what that approach looks like. But that's essentially the coordinated access system in a nutshell. So how does it work? So as I said, we have that triage and crisis assessment work. So what's going on during that initial engagement is you're determining someone's service needs and trying to connect to crisis resources. As I mentioned, right, there aren't enough resources for everybody that needs them. So what we currently estimate our capacity is around 25%. So we can meet about 25% of the shelter demand through the coordinated access system currently. So that means that, you know, only one out of every four folks, really are able to access shelter at the point that they're, requesting it, which is challenging, right? And it's a challenging environment to work under. So we talk a little bit about how to help with messaging, and we also talk a little bit around how to help assist with escalating really vulnerable clients to make sure that they're able to immediately or more quickly access some of those crisis resources. And as I mentioned about housing problem solving, that's really a key component of the housing assessment approach too, is once we kind of are able to get past crisis and kind of help, move folks through the system beyond crisis, it's utilizing that conversational case management approach to help explore those client supports and barriers to support with rapid exit and prevention from homelessness through one-time financial assistance, and completing housing assessments using the housing conversation tool, and developing goals through the individualized service plan to identify pathways out of homelessness. All right, so how do folks currently access CAS resources? Well, we have one central access point currently in our community, and that is by calling 211 and pressing 8. Folks who are experiencing homelessness or at risk of homelessness can connect with a CAS specialist 24 hours a day, 7 days a week, 365 days out of the year. It's a universally accessible access point that also offers like language interpretation services and is really also skilled with housing problem solving and can help navigate folks to crisis resources in particular. So they really focus more on crisis resources and connecting clients with those crisis resources, where those CAS assessors working within crisis resources then focus more on the housing conversation tool and connecting folks to housing resources. We're also in the process of developing physical access points, which will be kind of an alternative to the virtual access point or to the telephonic access point through 211, where folks will be able to drop in and do a appointment-based access point services. So complete assessments, go through that triage approach. And we're also developing a virtual application for young folks as well. So youth between the ages of 18 to 24, there are also unique resources for that population. So we're working with providers and a developer to essentially create an application that youth would be able to use from their phone to help assist them in navigating through resources through the coordinated access system. So what are CAS assessors? So CAS assessors, you all are in that cohort to become a CAS assessor. So CAS assessors are staff that are trained by Sacramento Steps Forward, that's us, to administer CAS assessments and understand the various roles and responsibilities of a CAS assessor, and pass your quiz and sign you up using user certification forms. Currently, we have about 600 active CAS assessors. This represents about 60% of our HMIS user base. So a good chunk, right? About the majority of HMIS users are also active CAS assessors, which is great. So the requirement is you do have to attend training. So you're at step 1 of attending that training now. You do have to pass the annual certification requirements, and you have to remain in good standing to continue to be a CAS assessor. So essentially what CAS assessors do in many ways is they support clients through agency activities. So think like the hat that you wear currently in your organization. Maybe you're a shelter case manager, right? Maybe you're an outreach worker. Maybe you work at a drop-in or community center, right? And you support clients and sort of navigating resources there. So you continue to do that, and this is just another hat that you are wearing. And it's a way to help streamline and coordinate care and resources through this approach, to the coordinated access system approach. And as a CAS assessor, you have the ability to do the same thing that 211 does, right? So rather than having to direct clients to call 211 and press 8, you actually have that ability to do the very same thing that 211 does, right? And so that's some of the, I guess, like bonus points of going through this training, right? Is that you then provide your agency with a valuable access into the coordinated access system resources by being a trained CAS assessor. So this is something that follows you through different agencies as well. So if you're a CAS assessor, and you change jobs and move to another organization, you still can continue to be a CAS assessor once you reactivate your HMIS user license within that new agency. So this is hopefully a valuable skill set and something that is something you can put on your resume and just help folks know that you are a trained CAS assessor. All right, so let's talk a little bit about what the responsibilities are. Um, just checking real quick on my Q&A as well. All right. So how do we gain access and become HMIS certified? Great question. We're not going to focus too much on that during today's training, but there is a link in the chat for you to be able to go ahead and sign up and begin that process. Um, what's the difference between CES and CAS? So as I mentioned, there really isn't a difference at all. It's just a different acronym. It's a different way to talk about it. So in the past, we referred to ourselves as the coordinated entry system. A lot of communities still do call themselves coordinated entry. Um, the distinction, and you may sometimes hear us say both, is that HUD sort of authorizes systems to create a coordinated access, coordinated entry systems. And so, or coordinated assessment process, right? So there's different language that's used, but ultimately, some of that language does come from the federal government and HUD. All right, you have HMIS access, but no access to the housing tool or ISP. That might be because you're not yet a CAS assessor. If you did complete the CAS assessor process, I would recommend attending next week's training, which will help provide a refresher on where you can find the assessment tool and how to complete some of that within HMIS. Can we enroll clients in the CAS program? Yeah, you'll need to do that, right? So if you want to complete assessments with clients that you're working with, you'll first need to enroll them in the CAS program within HMIS. And again, that is something we'll cover in next week's training in a little more detail. Uh, thank you. All right, should CAS assessors be completing housing conversation tools with anyone that wants to be on the housing queue? If not, what is the criteria for providing housing conversation tool? Um, Yes, absolutely. So if you're working with a client that you're trying to navigate into housing resources, you absolutely should be completing the housing conversation tool. Um, we'll talk a little bit more about that at next week's training as well. There really isn't criteria for providing that. It's just that is someone, currently experiencing homelessness, or at risk of homelessness, and you might be getting to a little bit more around the prioritization, right? So if someone's not immediately prioritized for resources, sometimes we have heard folks like say, well, what's the point? Like, why do I even bother doing this if they're not going to be prioritized? We'll talk, like I said, we'll talk again more about that next week when we talk about developing the individualized service plan. But it does go beyond just the assessment process itself, but providing the tool to help you have that conversation with folks and explore what resources might be available to them within the system and if there aren't necessarily resources that they'll immediately be prioritized for, then developing alternatives, right? And understanding what might be that pathway out of homelessness if those resources aren't immediately available to support folks or imminently available. Is it possible to have a list of access points so that people know where they can go? Well, there's really only one. So that's 211. We do have flyers available on our website that folks can access. I'll show you that in a few moments as well. Um, but yeah, I'd just direct folks to contact 211 and press 8. Please remember to say the press 8. I know a lot of folks don't always say that. And that can lead to frustration if they're not pressing 8 and they're going through the main line, which can have much longer wait times. So that 24/7 staff support with additional, CAS specialists is through that press 8 line. So please remind folks to do that. Can someone call 211 and request for a CAS assessment? They don't need to request the CAS assessment. They don't need to know that language specifically. But again, make sure that they're pressing 8 when they call 211, and they will be directed to that specialized line that does complete things. So they will ask them if they consent to having their information entered into the homeless management information system and shared with other providers. And so once they complete that initial creation of their profile, then they're able to complete some of those assessments. And again, we'll talk more about that next week. Is there a PDF version of the HCT or ISP? I don't believe so, and part of that is because we haven't created like paper forms for it. We're focusing more specifically on how CAS assessors can complete it. I think the concern is once you have um, paper versions of the HCT essentially floating around, is you might have non-CAS assessors essentially delivering that tool, and so that hasn't been something that we've created so far. Do we have our clients push 8 to get updated information on their referral? Yeah, so if clients want to call and update status, I think that's particularly important, especially if you yourself are not a CAS assessor. Ideally, if you are a CAS assessor, you can help them update their information in HMIS. If someone, we'll talk more about it later, but if someone is extremely vulnerable, there is also kind of a dedicated backline that we can talk about how folks utilize to immediately connect it. It's not for clients though, it's for CAS assessors. But yeah, if your agency doesn't do CAS assessments and folks need to update information on their referral or, complete, essentially the crisis assessment has to be completed like once every 90 days. And we do ask that folks update their status at least once every 30 days as well. So if you're not able to do that, 211 is able to support that. All right. Y'all have a lot of questions. It's great. Okay, if a household is at risk of homelessness, can they be referred to the community queue? Yeah, absolutely. So there is a specific community queue, and this is sort of HMIS language for supportive service programs. And I believe if there isn't one currently, there's probably one imagined for homelessness prevention programs in the near future. So 211 does connect clients to homelessness prevention programs currently. A lot of folks are familiar with the problem solving access points or PSAPs. That is one example of a homelessness prevention program. But there are other programs as well, like the anti-displacement program and the LEAP program as well also does some homelessness prevention. So these are things that 211 can connect folks to through the crisis assessment. All right. I manage 12 housing navigators for CalAIM community support services. Should all of my housing navigators become CAS assessors? Yeah, probably. I think it's a good approach. So a lot of what CalAIM will do is try to connect clients to market rate housing, right? Through and I know transitional rent is coming right around the corner too. So a lot of what the housing navigators will be able to do um, is great. I think some of where the overlap would be helpful is if you have clients who maybe need more intensive supports or long-term subsidies in particular. Obviously, like exploring the housing choice vouchers when those are available is an alternative as well. And in some cases, if you have really vulnerable clients, navigating the CAS system for permanent supportive housing can be helpful. All right. You enrolled someone in the CES system, but now they're showing up on your caseload with NHMIS and they are no longer in your program. Yeah, so what will happen essentially is when you enroll someone into the CAS program in HMIS, you'll show up as in HMIS as someone who's active, involved with their case. even if they're no longer in your home agency's program. So one of the things that, we essentially what we try to do is if you're working with that client as a CAS assessor and you're still engaging with them, that you're going into HMIS and you're updating their status once a month. If you're not updating their status, they will eventually be auto exited from the coordinated access program. And at that point, you would no longer be on the caseload for them once that program enrollment does end. All right. Is CAS just for homeless? What about clients that are facing eviction? Yeah, as I mentioned, so homelessness prevention programs do target folks who are not yet homeless, but they are at imminent risk of experiencing homelessness. So you can definitely have folks call into 211, press 8, and they can get navigated into homelessness prevention services. All right, I have a couple of clients do the HCT through 211 and they score very low. It doesn't capture their situation. How do we get this updated or screened again? So that's one of the things that, Jessica, as you become a CAS assessor, you'll also have the ability to complete assessments, right? Or if someone on your staff can potentially do that. I think that's why we definitely recommend that agencies have CAS assessors, because it can be difficult to properly screen folks with the housing conversation tool through 211, right? It just some clients may feel more comfortable sharing information over the phone, others may not. And so if you already have a rapport and relationship with a client and they trust you and will open up and engage with you, we definitely recommend that you be the person that completes that housing conversation tool with folks. So hopefully that helps clarify that. But again, there are some processes for getting the client reassessed, especially if their assessment doesn't seem to capture their situation accurately, especially as you know it. But again, I really recommend that that's best done by the agency that best knows their situation and circumstances. So having a CAS assessor on staff can really assist in that process. All right, if you had access from another county, would I reach out to the SAC email and see how I regain access? Unfortunately, if you had access in a different county, you will need to go through this training process to gain access, right? We use different tools than different counties. We might have different expectations and processes, right? So while coordinated access and coordinated entry have very similar elements across different counties and continuums, the approach can differ, right? And the types of resources can differ. So we definitely you definitely recommend, and if you want to be a CAS assessor in our community, you will need to go through the training here. What is the current average wait time for a client's name to come up on the housing queue? That's a difficult question. It can definitely vary, right? We have the average time is, yeah, it can vary again based on someone's current circumstances. So we'll talk a little bit more about extremely vulnerable households and what that approach looks like. But essentially, in a nutshell, what we kind of talk about is if your clients are not necessarily scoring very high, the likelihood of them getting into housing quickly is fairly low. It's not always the case, right? There may be specialized resources, especially if someone's maybe a veteran, or if they're in a specific subpopulation. There might be some other various resources that might be more readily available. Um, thinking like former foster youth or things like that. So there's definitely opportunities to explore resources and sometimes specialized resources. But we'll talk more about that next week. All right, how can we follow up on a client's background status for some shelters, such as the tiny home shelter? Yeah, so I would definitely check in. If you're interested in particular shelters, it's probably good to learn more about that program in particular. So a lot of the safe stay communities, like such as the Stockton Safe Stay, utilize a closed referral process. So the Stockton Safe Stay program, which is like a tiny home shelter, is not something that currently goes through the coordinated access system, right? They are envisioned to do so at some point in the future, and we'll definitely let folks know once that does become activated. But you will need to research and learn a little bit more about some of those programs, because not every shelter goes through the coordinated access system, just like not every housing program goes through the system. So we do, I like to say, I think we have at least the majority or close to that. So it is a good use of time to still navigate folks to try to navigate folks through the resources here. but unfortunately it does still require CAS assessors to be skilled in understanding what also is outside of the system and being able to know how to navigate folks to that if they do qualify for it. Can a CAS assessor utilize problem-solving access points? Great question. So once folks go through the housing problem-solving training, which is that conversational case management approach, folks will be able to have an opportunity to have their agency become a problem-solving access point, which would allow you to request and utilize some of the one-time financial assistance that we have made available to those PSAPs. All right. Does an agency need to complete an annual program recertification through HMIS to reflect any changes? And what if they have several programs? Let's see. Program recertification. Um, I think that's probably best directed to HMIS. I believe so. I think we actually, if you have like changes to your capacity or the number of beds that you have, you can actually update your information more frequently. You don't need to wait for that annual approach to do that. All right. Curious if one was already done for the client through 211 and can we rescreen them if the information is inaccurate? Yeah, yeah. Okay, so we'll talk more about that next week too, but essentially, like let's say you're working with a client that already went through the 211 process and now you're working with them now and you're like, wait, the score and like the way that they responded to that assessment, like their circumstances seem really different. Like maybe it wasn't that they answered it differently, but maybe things have changed since the last time they completed an assessment. Yeah, you're absolutely allowed to reassess someone earlier than the 90 days with the crisis assessment or earlier than like the 15 months with the housing conversation tool if their circumstances have changed significantly. And that can look like the fact that the responses don't match the circumstances that you're aware of what they have going on. So that is definitely one of the reasons why you can complete an assessment with someone earlier. Y'all are asking some advanced CAS assessor questions. So I'm assuming you must currently be a CAS assessor, which is great. Okay, when we update someone's current living situation, it has to be a living situation verified by what dropdown should we be using? Okay, so we'll talk more about that next week. We're going to focus more on how to utilize some of the HMIS tools, but essentially you do need to, I believe, indicate that you're in the CA 503 COC. So that's what we refer to as our continuum of care. So if you click CA 503, it will then provide a drop-down list of all the different agencies. And so then you'll find your agency within that drop-down under CA 503. All right, for the tiny homes on Stockton Boulevard, are referrals only going through DCR? I believe so. I think that probably is a question best directed to First Steps Community, who's the operator on Stockton Boulevard. But the way it works, from my understanding, is that clients were identified using a outreach approach that was done a few months before the Stockton Boulevard opened. So they're engaging with clients that they've had a previous engagement with through that process. I think once they exhaust that list is when I've heard them talking about making that program available through the coordinated access system. All right, last question. Okay, I enrolled a client into our Stockton Safe Stay program, and in order to add a current living situation, I had to also enroll this client in the CAS program. After this enrollment was completed and the client was transferred to another case manager's caseload, it's still showing the client is active on my caseload, but under the CAS enrollment. Yeah, so the caseload feature in HMIS isn't so much like it isn't really designed to, I think, reflect what the true caseload is. So like when you go into the assessments itself, you can indicate who's currently engaged with that client, who's the primary contact person for that client. So like when 211 is reaching out to folks, or let's say when SSF staff are reaching out to folks, sometimes they'll reach out to everybody that's listed just to try to like get in contact with the right person. I think one of the worst feelings is when you've got an opening for somebody and you can't get in contact with that. What a lot of folks have done is they actually create kind of like a standard like email or like a general response email for their program. So like I think like Community Health Works did something like this where they basically create like a, you know, case management at cohiwo.org or something, right? So it's like essentially then referral staff can contact the general email because we know that clients may change case managers and like sometimes case managers leave the organization entirely, right? And so you want to still have a way to get in contact with somebody. So that might be something to consider. Patrick Cornell is weighing in. Yep, that's what they do. And it is actually very helpful for us and I think for 2112 to be able to have like that general line that is monitored because even if that person has changing case management, we can get in touch with somebody pretty quickly. And it's not just going to like a dead inbox that's not being checked, right? So I definitely recommend like exploring things like that, just knowing that we do use emails and contact information within HMIS to try to get in contact with somebody. But we do try to honor what is reflected in the individualized service plan or in the assessment record. So those are things that we definitely look at and you can update those things. But yeah, if you want to make sure that, you're not getting contacted for clients that you're no longer engaged with, just try to make sure that that information is updated correctly, to reflect that you're no longer working with them. And as I mentioned earlier, if that person falls out of the system and is no longer engaged, that program enrollment with the coordinated access program will eventually close. And I think you'll no longer be reflected on that record too. All right. Uh, to utilize the PSEP funds, what training do you need? So you need all these trainings. You'll need to have done all 5 of these training series. You will need to have HMIS access and be a CAS assessor. And then you will also need to do the conversational case management training that I mentioned earlier. That is a prerequisite for all CAS assessors to access the problem solving access fund. So we do the housing problem solving training, which you'll learn more information about. Um, or something equivalent like the motivational interview. All right, if someone switched agencies in the same county, do they need to redo this training and retake the test, or will they just have the access from the previous agency? Great question. So if you've worked within the same county but different agencies and your CAS assessor certification is active, it will follow you. You'll just need to reactivate your account under a different agency, right? So the way that it works is when you leave an agency, your agency is required to notify HMIS that you're no longer working there, right? And so what they do is they deactivate your account under that agency. And when you start working at a new agency, that new agency has to request access for you under that agency. And at the point that you are activated, if you have current CAS assessor status, my understanding is that you will be also activated as a CAS assessor under that new agency. HMIS is managed by Sacramento Steps Forward, and for both Sacramento and Yolo County. Thanks. Appreciate that. Let's continue with the training. All right. So the CAS Assessor Responsibilities. So as a CAS assessor, there are some things that you must do to make sure that you're following all the requirements that are laid out. So essentially when you request to become a CAS assessor formally after having attended all the trainings, there will be a CAS assessor user agreement form that you have to sign. So this is a bit of a summarization of what that user agreement form states. So essentially when you are completing an assessment, you do have to read those questions without omitting or adding your own questions. I think in terms of explaining what the question is saying, you're definitely welcome to explain the question if folks have like a hard time understanding what's being asked. Assessments do have to be conducted in a confidential setting, right? So you should not be conducting an assessment like, say, in front of a bunch of other folks that are sitting around listening in. It should be in a space in which, we recommend like a private office setting with a closed door where folks are, out of earshot and not necessarily listening into the assessment that's being done. There can be some triggering questions within that assessment. So definitely, recognizing that some folks may not feel comfortable responding truthfully in a non-confidential setting. So you cannot go in and like intentionally change the client score. We actually say that like once the assessment's done, you're really not supposed to go in and change it at all, right? So what we mentioned earlier in one of the Q&As was that if, say, somebody's circumstances have changed significantly since the last time they did an assessment, you really should just do a new assessment entirely. Like you shouldn't just go in and change that one response. Don't do that. We do monitor folks' use of the tools, so we definitely like that's strongly discouraged. So don't do that. Just complete a new assessment. We'll talk a little bit more about that. A client's answers should not change after assessment's been completed, right? If a client situation changes, a new assessment should be conducted. Like I said, if a client has difficulty understanding the questions, you can offer reasonable accommodations to they help ensure that they understand and can complete the assessment. Um, Assessment scores should not be shared with the client, right? So you shouldn't be like, "Oh, great, you scored a 12," right? Rather, you should really explain the purpose of the assessment and how it informs the housing plan. Do not guarantee specific housing timeframes or make definitive promises. We've heard this a lot, from case managers in the field and stuff like that, or just like when we work with like shelter staff, like we hear a lot about clients who have been promised things, right? They're like, "Oh, we're going to get you into this housing program," or like, "This is something that we're going to make happen for you," and then that person they never hear from that person again, and it really does negatively impact that client's outlook of the system and also often their hope and optimism for the future, right? So really, like CAS assessors do not guarantee specific housing timeframes, right? And don't make promises that we're not able to keep. If you suspect an issue with the assessment record, for instance, maybe appears that something isn't working properly, or if you've noticed that someone's assessment appears to be too low, or there's an issue in particular, like please let us or HMIS know. Sometimes it might be an HMIS challenge. Sometimes it might be just something around the need for a reassessment to be done, right? But when in doubt, just reach out to us here and we can help provide some additional guidance there. So your code of ethics here is that it's important that you continue to build your trauma-informed care and motivational interviewing skills. We've talked a lot about motivational interviewing and conversational case management in general today and how that is a cornerstone of what CAS assessors do. So in order to be really effective as a CAS assessor, you do have to continue to build the chops, right? So you have to continue using it. If you're someone who is very infrequently doing assessments, then more training might be necessary, right? Like if you're not actively practicing, you should definitely be continuing to grow that. So when you do get called in to do an assessment, that you have the skills and ability to do that. Um, so, and on that same front, it's like the commitment to professional development, right? Continuing to grow as a professional within this workforce, continuing to grow your skills and training and ability, and then share with us what's working well and not working well, right? Like, a lot of what the training we designed today was in response to what we've heard from community members, right? Saying these are the types of trainings that have been really critical for me and my understanding of how to do this work. Help clients understand the purpose, use, and potential outcomes of the assessment, right? If folks don't understand why you're completing the assessment, the likelihood of them providing like truthful responses lowers, right? So if they understand why they're being asked these kind of triggering questions, what the use of them will be, right? I think they're more likely to open up and be honest with those responses, and you'll have a better sort of rapport and relationship with them. Treat all clients equally, respectfully, and fairly. Definitely don't like have favorites. Um, Disclose any potential conflicts of interest, right? Do not discriminate based on race, color, religion, national origin, ancestry, disability, age, sex, or sexual orientation. Continue to practice cultural humility, right? Like we don't know everything about every culture. It's important for us to continue to like learn more and you know know what we don't know and practice humility there. Report any observed unethical behavior or policy violations, right? So if you note that somebody's doing something unethical or they're engaging in specific policies that violate what we've talked about today, like that's definitely something that should be like notified. If your agency doesn't have any specific rules against that, which I would be surprised, like it would be a rule, a violation of the CAS policy, and that person, should not be a CAS assessor. And then uphold the highest standards of professional conduct in your CAS assessor role, right? As we mentioned, it really is like a privilege in some ways to be a CAS assessor and to have the ability to navigate folks through the system as a non-access point role, but to have, access for your agency through this CAS assessor position. So we really do have high expectations of the professional conduct that CAS assessors have. So do not condition the administration of CAS assessments in ways that do not align with CAS policies and procedures, right? Like don't say require that someone, complete 90 days in your program before you'll complete an assessment with them, right? Like don't have specific preconditions or things of that nature that don't align with our policies. Uphold and protect the client rights related to privacy and confidentiality, right? Don't share information about one client's assessment with like another client, right? Don't talk openly with your colleagues about an assessment you just completed that other clients potentially are able to overhear, right? Continue to maintain that you're protecting their rights and to privacy and confidentiality. Please note that you are responsible for developing a housing-focused support plan after completing a housing assessment. So this is a requirement that all CAS assessors have to do. So if you are going to complete the housing conversation tool, which we recommend, of course, doing with clients that you're navigating to housing resources, you then do need to create that individualized service plan. So many organizations already do an individualized service plan with their client, which is great. You can use what you've already input for that there. But what we do want to see is the reflection of a housing focused individualized service plan within HMIS, right? So at minimum, you need to update, what is the plan that you're exploring with this client? What are those resources, whether in the system or outside, that you're trying to navigate them to, and then provide updates on what the status is, right? So part of it is if you're planning to house your client through your program, let's say like behavioral health is a good example, right? So maybe this client has intensive behavioral health needs, and as a behavioral health agency, you're taking the lead on doing some of the housing with that client. Reflect that in the ISP, right? Reflect that you're exploring, dedicated housing resources through this process or approach, so that other CAS assessors or folks who might be working this client know that you know this agency's taking the lead and that they may be playing more of a supportive role in supporting that client and not need to be actively exploring alternative housing resources. We've also heard from folks that when clients have multiple housing offerings, it can be very confusing and challenging, right? So we definitely want to make sure that we're coordinating and working together. And that's what HMIS and some of these tools like the ISP really come in handy, is being able to coordinate and work across agencies and CAS assessors to develop the best plan and provide the support to clients. All right, adhere to emergency procedures for client safety and crisis intervention, right? Do not put yourself in risk to complete assessments. If a client is identified as an extremely vulnerable household or EVH, escalate their case appropriately to ensure they receive immediate support in navigating the crisis and housing resources. Do not use the HMI system to defraud or attempt to defraud federal, state, or local governments, individual entities, or to engage in any illegal activities. Not only will that result in you losing not just CAS assessor access, but you'll also lose HMIS access, and it could potentially have consequences beyond that as well. And your HMIS activities, I want you all to note this, is subject to regular monitoring and that you are required to undergo site-based monitoring. You may be required to undergo site-based monitoring, right? So just note that you may receive emails from some of our staff saying, hey, we noted that you didn't complete an ISP after you did the housing conversation tool. Like just note that that is a requirement and you do need to do that. Or something, maybe an error was done. We've seen folks do assessments with the dependent children in the household as opposed to the sort of the adult head of households, and noting that that will definitely have negative impact on their ability to access resources, right? So there are things that we'll monitor, not just, for punitive standpoint really, but more so as a on like training tool to make sure that folks are utilizing the tools correctly. Be open to feedback, support clients in submitting grievances as necessary. All right, so I'm going to talk a little bit about what resources are available within the coordinated access system. So there are currently 15 emergency shelters in the coordinated access system, which reflects about 1,000 shelter units approximately. This includes family, individual, and youth shelters. There is some short-term limited case management services that are available. So we refer to them as sometimes like short-term or bridge case management. This is operated through like the coordinated access navigational team. The goal here being that, within 45 days, folks are getting connected to more long-term sustainable case management. We're also in the process of trying to work more with CalAIM providers that do provide more of that sustained long-term case management services, and being able to make those referrals through the coordinated access system is basically a community-based referral partner. Housing problem solving, right? So oftentimes folks think about this as the financial assistance to support in acquiring market rate housing. It can also include things like eviction avoidance. More broadly and generally, just referring to it as like homelessness prevention type work. But it does include also some of those resources to help folks more rapidly acquire housing. Housing supports in general, housing navigation, which does require rental subsidy and client income, rental subsidies. There are some limited subsidies available through the coordinated access system and case management, which includes programs like rapid rehousing, permanent supportive housing, and other permanent housing. These programs do tend to be fairly impacted, right? And so that's why we'll talk more about that extremely vulnerable household. All right, as I mentioned earlier, we do have a flyer. So folks are interested in how do they direct clients to the coordinated access system. This flyer is available on our website and in 6 different languages: Arabic, Cantonese, Hmong, Russian, Spanish, Vietnamese, and I think actually maybe one other as well. So you're more than welcome to print those out, put them up in your site as well, and share that with clients. All right, so if you're kind of a geek like me, you'll like some of this type of information. So this is a bit of like a table here that shows the different resources in the left-hand column, and then the various different eligibility requirements that these programs have within CAS, and then what does that prioritization process look like? So for shelters, right, clients have to be experiencing homelessness tonight, which can include outside or in a motel or hotel paid for by an organization, respite center, or with friends or family. For TAY only, for that friends or family. There are shelter specific criteria. For example, there may be shelters that have like no 290s, maybe a shelter that requires that you have your children, instance. We do use like, the extremely vulnerable household prioritization criteria, as well as geographic preference, which does apply for individual adult programs only. The CAN team, that coordinated access navigators, which provide that shelter navigation support. Clients do have to be waitlisted for shelter and not currently working with a caseworker or manager. Again, they prioritize EVH households as well as families with children. Problem solving services. So folks have to be at risk of homelessness or currently experiencing homelessness, fleeing or attempting to flee. If they're seeking financial assistance, the support must resolve the housing crisis, right? So this is not an ongoing subsidy or a subsidy replacement. We do prioritize clients with eviction notices. Some of those rental subsidies, it can be dependent on the program, but in general, at risk of or currently experiencing homelessness, fleeing or attempting to flee a violent situation. We do prioritize EVH households and those with high housing barriers and a long length of time homeless. And housing navigation, at risk of or currently experiencing homelessness, fleeing or attempting to flee. The LEAP eligibility, right, requirements, which are changing now, so I need to update that. But there's information about that. And then clients with case management and rental subsidies are those that we tend to prioritize for that housing navigation support. All right, so how does this work? How do folks access resources, right? So we've got the access points and outreach, right? So this is access points and outreach staff, community-based centers, things like that. They're trained with CAS assessors, and they assess and support clients to access those resources. 211 can triage and refer eligible households to crisis resources, kind of centering all of this around people who are experiencing homelessness. We do have the CAN team that can be deployed to support clients who are on that shelter wait list. Shelters complete intakes and plans for housing stability and permanency, right? We've got CAS assessors on site at shelters who can do some of that, like housing conversation tool work. The Sacramento Steps Forward team, they host case conferencing and refer into COC housing programs. So there's a lot of different partners that can be involved with a client's case and circumstance, but ultimately all of us trying to work to move folks through the system effectively. All right, so I mentioned the coordinated access systems, the extremely vulnerable household policy. So the goal with this policy is to immediately prioritize households for the next available and appropriate unit, regardless of their current geographic location. So EVH is defined as individuals scoring 6+ on the housing conversation tool or crisis assessment, and families scoring 10+ on the same tools. And that represents about 20 to 22%, right around there, of the population, right? So it's definitely not the majority of folks that are scoring within that range. It is a smaller subset, but it does sort of reflect a little bit about our like belief that those are clients that we can more rapidly place and support. So why did this policy get developed, right? Well, it's because in many cases, geographic preference was considered over someone's vulnerability for most individual shelter placements. What that did is it created a lack of alignment between shelter and housing prioritization, meaning that shelter stays typically were going on longer than necessary, and shelters often had to rehouse clients independently from COC support. So basically, what you're seeing is, the COC programs prioritizing more folks that might be unsheltered versus those that are currently within shelter because of the misalignment around the population of folks that are being served. Also, you've got a lack of case carrying support in our community in general. So what that means is that a lot of clients' engagement with the system might be like one time. They might only have that one contact before they, become inactive within the system. So if we're only going to have that one interaction, it really needs to be a useful one. That inability to rapidly place households in a shelter when initially presenting, right? We hear a lot from service providers who are frustrated that they're not able to sort of strike while the iron is hot, right? And so what this does is in limited situations when you're working with one of these extremely vulnerable households, that you're actually able to work to try to do just that, right? To engage with the system to try to get that client placed same day in situations when they are extremely vulnerable. All right, so essentially how this works is, you've got crisis staff reviewing the client's eligibility and determining if the same day shelter referral can be made. This is the work that 211 is doing essentially. So the assessment's being completed by any CAS assessor, right? Um, Essentially, you've got once you complete it, HMIS gives you an automatic indication of whether or not this person is extremely vulnerable or not. So when you complete the assessment, as I mentioned, you have the score to refer to, but you can also click eligibility and it will tell you if someone is extremely vulnerable by indicating that they score over 100 essentially, or they score 100 in the extremely vulnerable households row. So if you're in the field, right, if the CAS assessor is in the field, they can contact a dedicated backline. So you all will be able to do that to escalate a case to the crisis referral staff. So the backline is available Monday through Friday from 7:30 a.m. to 4 p.m. There is a phone number here. Again, this is only for CAS assessors. So we'll talk more about how to do that once you become a CAS assessor. Um, then the staff at essentially 211, what they'll do is they'll review that assessment. They'll determine if a same day referral can be made. If the client is unable to be placed into an emergency shelter, the crisis referral staff will explore alternative options until a shelter intake can take place. That might be looking like case management services, maybe referring someone to the CAN team or to ECM services. Once that client is connected to an emergency shelter, case management staff will support the client in getting dock ready, right? So that's the alignment between shelter and housing. So if you're extremely vulnerable for shelter, you're also extremely vulnerable for housing, which means that clients can be prioritized for housing options such as rapid rehousing and permanent supportive housing. So if shelter staff are working with extremely vulnerable households, they should really be working to get them document ready, which is one of the trainings that we'll be offering. All right. So if you're interested in learning more about or being a part of some of the discussions that we have around the system level, you can join the Coordinated Access System Committee. We also have a Racial Equity Committee. Often these two committees are working closely around some of the different objectives. We also have our Frontline Learning Collaborative. This is really designed for staff who are working on the front line of homeless services, doing direct service work. They meet on the fourth Thursday of the month. It provides opportunity to network and connect with other staff that are doing that work, as well as there's usually a guest speaker that comes to talk a little bit about some of the different resources that might be available outside of the system or even sometimes inside the system that is helpful for folks to learn more about. And of course, we have case conferencing. This is an action-oriented program that involves coordinating among homeless service providers to transition clients into housing swiftly, and they operate on a 3-month cycle with weekly meetings. So you can learn more about this on our website as well, and we also share this information with CAS assessors once they join the ranks. So if you want to sign up to become a CAS assessor, you do need to join HMIS. So there's the HMIS access request form, which is in our chat today as well. If you want to join our mailing list, you can do so here and subscribe to various different offerings and opportunities. And if you want to get trained in housing problem solving, you can also get a link to that from our website. For any CAS specific questions or grievances, you can contact CAS at sacstepsforward.org. Okay, so with that, I know there are questions that folks have, and I think we also have a poll for you as well. Is that right, Jody?
You know what? In the interest of time, we're going to skip the poll questions if that's okay, Peter, and just move along.
All right.
Yeah, thank you.
Okay. Um, so let's get into some of the best practices, and then with the time remaining, we'll focus on answering any of your unanswered questions. And I know folks have a lot of questions. I am optimistic that many of them will be answered throughout the 5-part training series we have. So I'll do my best to try to redirect as possible too, to help be mindful of everyone's time. All right. So in terms of best practices, we want to help understand what the housing conversation tool does. How do we apply these best practices for assessments and planning, and ensure compliance and effective data management? All right. So let's talk a little bit about the housing conversation tool. So this is the replacement for the VI-SPDAT. So if folks are familiar with that acronym, I won't explain it today, but that was the previous housing assessment tool that is used. And if you've worked in other communities, that's often the assessment tool that was used in other communities as well. The problem with this tool is that it promoted racial disparities. So what happened is a work group was formed that included individuals with lived experiences of homelessness, members of the Racial Equity Committee, and various community partners to develop an alternative tool. So this tool was not designed to necessarily understand the household's holistic needs. Instead, it really focuses on identifying urgent cases for intervention while providing a blueprint for assessors to develop an ISP, or an individualized service plan. So this change provided us with an opportunity to align resource prioritization and reset the standardized CAS assessor expectation and best practices, right? So in many ways, the change in the tool also allowed us to make some changes around expectations and how folks engage with the system, and what does that process look like from responsibilities and expectations of a CAS assessor. So the major changes here is that this is a single tool for all household types now. So in the past, there was a variety of different assessment tools that folks had to kind of know when to use. Like maybe you had to do the FYI assessment, or maybe you had to do the LEAP assessment. All of that has now been combined into the housing conversation tool. So that really helps streamline resource provision now. So you don't have to also know when to deliver a specific assessment. You just know for all households, for all housing programs, you do the housing conversation tool. It does have broad applicability. I think the VI-SPDAT was really limited to just assessing folks who are experiencing homelessness, whereas this does provide a more general accessibility for folks who may be at risk of homelessness as well. There are fewer questions. We offer better phrasing as well. I think one of the main things here is that this was developed by people with lived expertise of homelessness with broad community feedback. So we worked a lot around the design of how the questions were actually asked. And this is really with the intent to be designed with a more human-centered and racial equity focus. And a lot of folks, surprisingly, this comes up a lot, but people will say, I can't find this assessment, right? So in the past, assessments might be available under your home agency. Well, no longer. Now the assessments are only available under the CAS Assessor Agency. So once you become a CAS assessor, you will also be granted access to this agency. And so you will need to enroll a person into the program under this agency. And once you do that, you'll be able to complete the assessments as well. And again, if that's confusing, we're going to talk a whole lot more about it next week. All right. So we also have a CAS Assessor Best Practice Guide. It's about 40 or so pages that covers a lot of what we kind of have deemed the best practices when delivering this housing conversation tool. So we know that a lot of CAS assessors will spend a lot of their time kind of around this tool in particular, as you noted, like or as we've said before, right? 2-in-1 does a lot of the crisis assessments. And the crisis assessment in some ways is like easier to complete, right? So we focused a lot around providing best practices for the housing conversation tool. But I will say it does, like in many ways, I think these best practices are applicable to both types of assessments. It covers information in more detail than what this training does. So we definitely recommend that you reference this. It can also be helpful for your quiz. It is intended to be a resource, especially for new staff, and includes a resource guide. I think there's a separate link to a resource guide, or that's something in development. All right, so in summary, CAS assessors utilize three primary assessments within HMIS. They utilize the crisis assessment, the housing conversation tool, and the individualized service plan. So all three of those assessments will essentially be available to you under the CAS agency after someone has been enrolled in the CAS program, right? So the crisis assessment, you use this for shelter, homelessness prevention, and case management programs. The housing conversation tool you use for CAS participating housing programs. And the individualized service plan and case conferencing tool is for developing and providing updates on housing related goals and activities. So in many ways, it's actually kind of like a progressive assessment approach, right? So you start with the crisis assessment, you try to connect folks to crisis resources if that's something that they're connected to. A lot of CAS assessors actually work within crisis assessment programs. So you kind of skip a step in some cases if you're already, say, the client's already enrolled in a shelter and you really start at the housing conversation tool. But for clients, right, this is really the experience that they'll see. Um, and so the housing conversation tool and the ISP and everything is really designed, focused around how do we move this person from crisis into stability through housing programs, both in and outside of the coordinated access system. All right. So the crisis assessment, it replaced the previously shelter survey, which we had used in the past. It can assist with determining homelessness prevention eligibility as well. And the questions will kind of like lead you in that way. So like if someone is at risk of homelessness, like you'll have fewer questions to answer than maybe if someone who's currently experiencing homelessness and trying to navigate into shelter. So the way that works is like through HMIS, you will toggle a certain response and maybe certain questions will populate, right? Or maybe other questions will disappear. And that's by design, right? It's to limit the number of questions that you have to ask and trying to focus the conversation around the direction that the assessment believes you're trying to go. You only need to do one assessment for families and individuals. So you don't need to say, do an assessment on each person in the household, right? You'd only need to do one for kind of that head of household for families. And responses, I mentioned this before, but they essentially cascade is the term that we use into the housing conversation tool and into itself, essentially. So because there's a lot of parallel questions between the crisis assessment and the housing conversation tool, if you're completing them within 60 days of each other, you'll essentially have a lot of those answers pre-populate into the subsequent assessment tool. And as well as if you need to redo an assessment, right? We talked earlier through the Q&A, if somebody said scored in a range that didn't reflect their experiences or they've had a significant change, right? And you're doing a new assessment. If that assessment's been done within the last 60 days, you'll all those answers will pre-populate under the new one, and you'll have an opportunity to kind of more quickly go through that assessment process to make those changes. So that's just one way that we try to be responsive to your time and respect that folks have a lot going on, but that we want to make sure you are able to make changes quickly and effectively without compromising some of the integrity of the work. So when administering CAS assessments, it's really important that you develop that rapport. We talked through that through the Q&A as well. And really this is done through trauma-informed practices, right? Through the motivational interviewing, through conversational case management, and making sure that we're engaging with empathy, that we are doing our best to address crises before conducting the housing conversation tool, right? It's often not a best practice necessarily to try to engage in this more lengthier assessment process focused on housing outcomes and resolutions if they have a current crisis happening right now that isn't being addressed, right? You do need to conduct these in a safe and confidential environment, as we've mentioned, explaining the purpose, do not make any promises, and escalating extremely vulnerable clients appropriately through that process we've talked about. Here is essentially what the housing conversation tool looks like within HMIS. So some of these things, and again, we'll cover this a little bit more detail next week as well. But essentially, when you're in HMIS, some of these answers will be pre-populated for you. But you will have opportunities to collect things like the assessment location. Is this being done over the phone? Like who's the assessing agency, for instance? Is this being done with a household, right? Is this being done with an individual? And then we collect various information around the household, like such as pregnancy status, how many children are in the household, whether or not custody of the children. Is it a single parent household? Are any of the adults in the household enrolled in foster care after the age of 16? And I'll just preface this by saying all of the questions that we ask are either tied into eligibility requirements or prioritization factors. So we try not to ask any questions in this assessment that are unnecessary or superfluous or just like would be nice to know, but not required to know. And that was some of the feedback that we heard directly from folks who had gone through this assessment process themselves, is wanting to really limit it to just the most essential questions being asked. Of course, income is always pretty critical. A lot of programs do have income requirements. This does not necessarily mean that you have to like upload documentation of this at the point of the assessment, though some programs may require that, right? And so just being aware that folks will need at some point to likely provide verification around this, but that's not essential at the point of the assessment. And then we do provide a like a helpful tool around AMI. So what is that annual median income for this client and what percentage are they kind of falling into? So you'll have an opportunity to indicate that. Some programs do have blanket eligibility that might say 40% AMI or less than 30% or something. Then we get into like housing information and history. So where do you and your household sleep most frequently? How often have folks experienced homelessness within the last 3 years in terms of months? How many sort of episodes has that looked like? Do you have a housing voucher or dedicated rental subsidy for at least 1 year? Do you have 2 to 3 trusted contacts you can list on a housing application? Has having poor credit or no credit or rental history prevented you from obtaining permanent housing? Have you or anyone in your household had an eviction in the past 7 years? Have you or anyone in your household struggled to obtain permanent housing due to immigration status? Have you or anyone in your household been affected by the justice or criminal system that prevented you from being housed? Have you or anyone in your household struggled to obtain permanent housing due to wait, that's a repeat. All right, physical health, mental health, and other vulnerabilities. So have you or anyone in your household member experienced a physical health crisis within the last 3 months? Have you or anyone in the household member experienced a mental health crisis within the last 3 months? And oftentimes folks ask like, can this be defined further, right? Like, what does that mean? And it really is sort of subjective to the client, right? So what do they define as a crisis? Or maybe, through some conversation with them and rapport that you've developed, right? You might help be like, hey, remember when you had to go to the hospital for that? Like that, is often, not probably the ideal way to get some of those health circumstances addressed. So like utilizing an emergency care for a physical health situation could be defined as a crisis, right? Having to use, mental health, like urgent care, mental health services, right? This could also be an experience of that. Maybe it's, the client has been having frequent panic attacks, right? There's a number of things that could help attribute to some of this. And again, but it's fairly subjective. So we don't provide an exact list or determination of what those crisis situations are. But that's something that is really up to the client to determine. Do you or anyone in your household have a long-term or ongoing disability? And we provide some examples there. Are all adults in your household able to independently care for themselves? This is important, right? A lot of programs require that folks have to be able to independently care for themselves. Actually, I think pretty much every program does. Do you or anyone in your household require housing related reasonable accommodations? And then there's some options to select there. Have you, in the past 3 months, have you or anyone in your household experienced any of the following: domestic violence, dating violence, stalking, sexual assault, or human trafficking? Then we get into like current services. So who's currently providing some of these services? Um, Animal information as well. So do they have service animals, emotional support animals? Is there anyone in the household required to register on the arson registry or the sex offender registry? There is some information that may pop up, right? So if folks indicate that they are registered as a sex offender, just noting that some programs do have restrictions on that, or certain criminal history convictions can also have some impact on that as well. Some programs do require actually that clients submit to background checks. And then we get into kind of the tool around like resources. So we do ask, and this again was designed based off input from service providers such as yourselves, but do does the household have any services that they need assistance with, right? And so this is an opportunity to sort of indicate what some of that might look like. In particular, we're really looking at something like rental subsidy. If someone's indicating that they need a rental subsidy, what is that desired need, right? For what does that subsidy look like? And there's options like you can select permanent, temporary, or like one time, right? So maybe someone just needs like 1 month of rent. Like if I just had 1 month of rent, I could get back on my feet, right? Or if I had, some assistance to get into like pay the deposit, I could do everything from there. Or maybe someone's like, I'm on fixed income. I can't get into, a lot of market rate housing without the ongoing like permanent subsidy. right? Or something of that nature. There could be situations in which people indicate that. So that's something in particular to pay attention to, especially when developing the ISP, which we'll talk more about next week. And then the case management services too. That's the other one I really want to focus on is when someone's indicating that they need case management services, there's an opportunity for them to select service levels here. Is this intensive and frequent, which could basically indicate that they need like, daily or weekly more intensive support, or maybe it's, more infrequent and moderate, right? So maybe, once every couple of weeks or minimum, maybe once a month or something, as they just need someone to help support and check in on, or maybe it's like one time or none, right? They don't really feel like they need any case management services. They just need the initial support just to access resources, and then they don't need any support after that. The rest you can pretty much kind of read and see for yourself. The idea being that if they are checking any of these resources, that there's an opportunity for your agency to provide them either with those resources or a information on how to access those resources in our community. So especially with the housing conversation tool, that feels really important. But we also ask this with the crisis assessment as well. All right, so I mentioned before, and I'm almost done, promise, that we do have the CAS Assessor User Agreement form. So all staff who wish to become a CAS Assessor must sign and return this form. So when you go through the assessment request process, you will be prompted to essentially sign and return this. It does outline the CAS Assessor Responsibilities and Code of Ethics, much of which we covered today or summarized. I do advise you to initial and read each section carefully. And we're working on having this be automated and signed digitally as well. I think that might be a functional possibility at this point. It does cover all CAS assessments and assessor responsibilities, not just the housing conversation tool. So in the past, if folks went through this, it was a VI-SPDAT agreement form. Now it's just the CAS assessor user agreement. So it's all the things that the CAS assessor must do, all of the responsibilities. It's not just related to the housing conversation tool, though we do recognize that is probably a lot of what you will do. All right, so I've got just a few minutes left to answer some of your burning questions. I will go through and try to see which of the questions might also be able to be directed to subsequent trainings, or if it's going to be covered by one of our future trainings, basically. All right. Are the forms that in HMIS that show as deactivated still valid for housing purposes? Forms that show as deactivated. It's a good question. I'm not quite sure I know what those are, so I'd have to like look at that to get to that, to better understand how to answer that. Is there a grace period from the time it's deactivated to the time it starts with the new agency? So yeah, essentially, if as long as you're still within, I'm assuming this is CAS assessor like status. So as long as you're still within that year that you've gone through the CAS assessor training or recertification, it's still valid. If say it's been, a year since the last time that you went through the CAS assessor training or certification process, you will need to go through the recertification process, which is shorter than like the new user training. So it's an abridged version of some of the training. We did something similar towards the end of last year. If an organization pays for a hotel stay, is it reimbursable? Not through us. Like we don't reimburse organizations for that. It really depends on if you have a contract with somebody that's, paying for that service, but that's not something that we support, and it's not an allowable expense through the problem solving funds either. So we can answer more problem solving questions during that training specifically. What does the score mean when it's a negative number? Yeah, good question. So don't look at the overarching score. The way that the HMIS like processor works is that some of those things don't necessarily populate on the general score. What you'll need to do is when you click into eligibility, you'll have an opportunity to kind of see what they score within each of the different sections. The Cliff Notes version is anything that if someone scores with 100 within a certain program type or a program, it will mean that they're eligible for that program. If they're scoring over 100, it means that they're eligible and prioritized. When there are availabilities, do most of it go to EVH, or is it equally split between extremely vulnerable households and households that score under 6? Great question. Yeah, it will generally go to folks who are scoring within the extremely vulnerable household range. There are some things like geographic preference and stuff like that that can still have um, an impact, certainly, for clients that are within that are accessing shelters that have that in place. So it kind of depends. For most housing programs, though, you're going to be prioritizing extremely vulnerable households, but in some cases, there may be very narrow eligibility of a certain program. And that means that by nature, you're going to have folks who have lower scores that go into it because you have fewer people that qualify for that resource. There used to be an ROI for the VI SPDAT. Is there one for new assessments? No, there's not. We did away with the release of information for the VI SPDAT. Now the general release of information for the client suffices for the ability to complete the assessments. Does the crisis assessment have to be done by 2-on-1, case manager, or both? Great question. You can, as a CAS assessor, you have the ability to do those assessments, whether it's the crisis assessment or the housing conversation tool. You do not need to have 2-on-1 do that for you. If 2-on-1, say, did the crisis assessment and you're satisfied with that assessment in terms of it doesn't seem like there's any issues or that the client's circumstances haven't changed, you can just move on to the housing conversation tool. So really, in some cases, like, especially if you're working with that client for a sustained period of time, it is ideal that they be the one that takes the lead on some of those assessments, right? So if you have that rapport, that relationship with the clients, that's really desirable that you be the one that kind of takes the lead on doing a lot of that work. Will attendees receive a confirmation? So you will receive confirmation of your attendance today in terms of just a follow-up email with recordings and stuff like that. We will be working to also track attendance. So folks that attended today's training, you'll have an opportunity to continue to along with the assessment process, right? You do need to attend all 5 of the trainings to be able to complete the certification. So we are trying to track and monitor attendance there. On the HCT where it states, where are you going to sleep tonight? Why is there not an answer for a shelter? On the housing conversation tool where it states you're going to sleep tonight. So it should, I don't think that question's asked on the HCT. I think it's only asked on the crisis assessment. I could be wrong, but on the crisis assessment, essentially what we're trying to determine is if someone is trying to engage in crisis resources, right? So if they're currently staying in a shelter, they may not qualify for a lot of crisis resources. That could be why that answer isn't one that's able to be selected. I do believe there's a current living situation, and then there's also where will you sleep tonight as well. So when folks are indicating that their current living situation is one that is, say, like something that is not yet a homeless response, then it starts to indicate, okay, so then where are you planning to sleep tonight, essentially? So they would, yeah, I'll have to explore that, but it would be sort of seems like counterintuitive, I guess, that they would be sleeping in a shelter and completing the crisis assessment. They'd probably be better off just doing the housing conversation tool if they're already in a shelter, or requesting a transfer potentially if that isn't the right shelter for them. All right, almost done. I may not get to every question. If an individual's housing conversation tool answers change, can you update the original to get a new score, or should you complete a new one? Always do a new one. Never just change the score. That's a violation of the policy. For families that are head of households or are not citizens or residents, are they given the same housing opportunities as those that are? That's a complex answer, Elizabeth, and one that's not easily answered during today's training. I recommend popping into our office hours to talk more about that specific impact because it does vary from program to program. Some programs have different requirements for citizenship status. All right. It asks where do you sleep most nights and shelter's not an option. Okay, thanks, Sophia. Take a look at that. All right, that was for an intake coming into a shelter when you're doing the HCT. Okay. Are there still housing navigators that go into libraries, parks to complete these assessments for folks who can't call? Yeah, we're working on it. So as I mentioned before, we're in the process of developing physical access points or mobile access points where some opportunities for folks to do that. Currently, CAS assessors can do that now. You see that a lot through like outreach engagement and stuff like that. But basically, it's not publicly advertised, right? So that's the main challenge, is that when we're advertising access point services, they do have to be publicly advertised and accessible. So a lot of that work to engage with folks currently might be through one-off events, but not something that is like publicly advertised. There could be some exceptions to that, like say like a resource fair or something like that. What do I need to do to keep a client in active status? Great question. We'll cover that more at next week's training. We'll talk about how to do the current living situation, which is the best way to keep your client active and up to date on an HMIS for housing programs. All right, we did it, y'all. We made it through the training. The exit survey will pop up once you leave the training. So thank you so much for being here today. I apologize for the speed at some point, or we are trying to merge two different sort of content into one training to allow for folks to get through it as quickly as possible. But thank you all for being here. I really appreciate it. We will take a look through the comments as well for other things we didn't get to, and try to get back to folks or provide updates at the start of next training. We'll see you next week for our HMIS and kind of post-assessment process.
Peter, do you have just several minutes to address some of the raised hands?
Oh, sure. I'm always happy to stay on.
I know you are. Yeah, can you see them, or would you like me to identify
Oh,
if
I
there's
do.
still
I do
none?
see them now. Okay.
Okay, fantastic.
Yeah, Anna. I don't know if we can unmute folks. Might need your help with that.
Got it. So Anna, you do have the capability to speak if you're still with us. You there
Hi.
we go.
Yeah, sorry, that was on accident.
And Anita, you are able to speak if you are still with us. Nope, that's it. Thanks, Peter. No more raised hands.
Yeah, Patrick. Darn. If folks do have questions, you're welcome to answer them. I'm happy to stay on a little bit longer. For attendance, that was captured when folks registered for the training, right, Jody?
Yes, so our training captures also the duration of which they're on the call with us as well.
Awesome. Thank you. And the slide deck, will that also be sent with the recording?
Yes, it's our standard practice for all trainings that we do virtually.
Allison, I see your question about I'm not sure if you're still on, but the question around like if another agency completes the HCT. Yeah, that's definitely possible, right? That you might be requested to do a housing conversation tool. And that may be because this client is likely to be prioritized for housing, and we want to make sure we have the housing assessment in place for them. So maybe they just only have the crisis assessment, but they're scoring in the EVH range. That could definitely be a situation. And the ISP that you would create would be pretty minimal, right? It might be just be like, hey, the ISP, in this case, we're trying to get them into this program. So that's their plan. And you wouldn't need to do too much more beyond that. But we will talk more about the ISP creation next week. Yeah. All right. I think that's everything.
All
All right, we'll
right,
go ahead and
I'm going to do one final plug for those of you that are still on. Some of you are asking about a notification for session 2. Each training you will need to register separately, and that helps us with tracking for CAS Assessor certification. So please go ahead and register independently for each training. Thank you. Thanks, Peter. I'm going to end the meeting now.
Thank you. See you next week.